Welcome dear student in my course named Determinants of Quality of Life. Today's title is Understanding Preventive Mental Health. Content of this module is Foundation of Preventive Mental Health Factors, Neurobiological and Psychosocial Foundations, Psychological Models and Intervention in Prevention, Digital Innovation in Preventive Mental Health, Policy, Ethics and Systemic Strategies, Design and Reflection Exercise, and last, Learning Outcome. Learning objective of this module is at the end of this session, learner will be able to define mental health and preventive mental health and differentiate between primary, secondary and tertiary level of preventions, analyze the neurobiological and psychosocial basis of preventive mental health interventions, evaluate evidence-based psychological models and therapies and support mental health promotion, identify risk and protective factors influencing mental health across the lifespan, explore policy, ethical and digital innovations perspectives in mental health prevention. Foundation of preventive mental health is based on the definition and scope, that is what is the preventive mental health, and differentiating promotion, prevention and treatments. What is the mental health prevention? Mental health encompasses emotional, psychological and social well-being, significantly impacting how individuals think, feel and behave. It's not just about the absence of mental illness, but rather a state of well-being that allows the individual to cope with life's challenges, realize their potential and contribute to their community. Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It has intrinsic and instrumental value and is integral to our well-being. Recently, mental health and ill health have been reframed to be seen as a continuum from health to all health, to ill health, through the stages of being asymptomatic at risk to experiencing mental distress, subsyndromal symptoms, that is some symptoms suggested to be mental disorder but not sufficient to reach diagnostic categories, and finally mental disorders. Mental health promotion, prevention and treatment represent distinct but interconnected strategies. Promotion focus on enhancing overall well-being and resilience, while prevention aims to reduce the incidence and impact of mental disorders. Treatment addresses existing mental health conditions, aiming for recovery and symptoms management. Promotion is an approach aimed to strengthening positive aspects of mental health and psychosocial well-being and is focused on empowering people to live healthy lives. Example, by facilitating healthy lifestyle through policies such as providing nutritious food in a school canteen or opportunities for physical exercises in accessible locations, rather than health being the sole domain of health professional. Prevention is an approach aimed to reducing the likelihood of future disorder in the general population of people who are identified as being at risk of a disorder. Prevention is further subdivided on the basis of the population targeted into universal, selective and indicated, as in focus in National Research Council and Institute of Medicine in 2009. Universal preventions, which include strategies that can be offered to the whole population, including individuals who are not at risk, based on the evidence that it is likely to provide some benefits to all, reduce the probability of disorder, clearly outweigh the cost and risk of negative consequences. Example of common universal prevention intervention, including the community-wide provision of information on positive coping methods to help people feeling safe and hopeful protection against human right violation. Example, gender-based violence. Community-wide effort to improve livelihood as a key protective factor for mental health. Selective prevention refers to strategies that are targeted to subpopulation identified as being an elevated biological, social, and psychological risk for a disorder, but who are asymptomatic or have very minimal symptoms. These interventions involve human supportive and practical help covering both a social and a psychological dimension. They work through communication, asking about people's needs and concerns, listening to people, and helping them to feel calm. Practical support, that is, providing meals or water, and with a psychological approach including teaching stress management skills and helping people to cope with problems. Facilitation of community support for vulnerable individuals by activating social network and communication, structured cultural and recreational activities supporting the development of resilience, such as traditional dancing, artwork, sport, and puppetry. These activities may take place in equipped setting with the aim of increasing the children's sense of connectivity and safety. Now discuss the level of mental health prevention. Level is primary, secondary, and tertiary. In primary level, goal is prevent onset. Example, resilience training in schools, as discussed in early slides. Secondary is the goal is early detection, that is the promotion and prevention, that is the depression screening in primary care. Tertiary is reduce severity, goal is reduce severity, and example is relapse prevention in bipolar disorder. Now discuss the global mental health burden, that is the mental health disorder leading cause of disability, and DALIS and while LDS, cost of untreated mental illness on health system and productivity. World Health Organization Mental Health Action Plan. Quiz activity for your classroom. Classify the intervention into the 3 levels of prevention. Students, you do this quiz. Neurobiological and psychosocial foundation of the mental health. Is first of all we discuss about neurobiology of mental health risk. Brain development and plasticity, especially in childhood and adolescence. Role of this is HPA axis in chronic stress. Neuroinflammation in depression and anxiety. Gut-brain axis and microbiota. Psychosocial risk and protective factors include the adverse childhood experiences and trauma, social determinants, that is example housing, employments and education that provided in social phenomena, family dynamics, that is the parenting style and peer relationship, protective factors, that is the social support, self-efficacy and coping skills. Life course perspective is mental health risk across the life span, that is the perinatal, childhood, adolescence, working age and elderly. Intergenerational transmissions of risk. Psychological models and intervention in prevention is cognitive and behavioral approaches, that is cognitive behavioral prevention, behavioral activation and self-regulation and emotional intelligence training. Mindfulness and resilience-based intervention is mindful-based stress reductions, that is MBSR, acceptance and commitment therapies and positive psychology interventions. Community and school-based model is social emotional learning in schools and peer-led intervention in school behavior, school classroom activities and mental health first aid programs in school and classroom. There is an interactive activity, compare and contrast MBSR and CBT in preventive outcome as discussed in earlier slides. Digital innovation in preventive mental health. Discuss about mental health tools. E-mental health tools is mental health apps that mood tracking, mindfulness and CBT. Digital CBT, that's called iCBT, VR therapy, chatbots for early intervention, example Wobots and Visa. Benefit and challenges of the mental health prevention, promotion and treatment is scalability, affordability and accessibility. Issues are data privacy, engagement and cultural fits. There is good discussion. Can AI replace human therapists in prevention? Write in detail with your result of your group discussion. Policy, ethics and systematic strategies of this mental health in public health system is World Health Organization Mental Health Gap Action Program, India's National Mental Health Program and Telemanas. Community mental health integration is work for mental health promotion. Ethical consideration is informed consent in digital therapy, stigma and right-based approaches, and cultural appropriateness of prevention programs. Workplace and higher education intervention about the mental health is mental wellness policies in universities and employees assistance program in workplace and burnout prevention strategies in universities and workplace. Case review for this is analyze in your university's mental health initiative and propose improvement. Learning outcomes of this module is mental health prevention is scientific, strategic and scalable, not just reactive. Early upstream interventions reduce social, emotional and economic burden of mental illness. Biopsychosocial integration is key. Mental health is influenced by brain biology, behavior, relationship and society. Prevention is not a luxury. It is public health necessity. That is the broad view. Thank you.